So if a lady is having a problem with facial hair growth, or which is also called hirsutism, the first thing that comes to our mind is hair removal by laser. So is laser the only thing that should be considered for treatment of excess hair growth? Or if somebody is having an hormonal imbalance like polycystic ovary syndrome, which is also abbreviated as PCOS, then there is a different aspect to it. I am Dr. Saptarshi Bhattacharya. I am practicing as a senior consultant in Indraprastha Apollo Hospital. Excess hair growth in the face or in other areas of the body, it can be because of two reasons. So it can be idiopathic, that is called idiopathic hirsutism. But the most common cause of excess hair growth is an hormonal imbalance, which many of you already know, that is called polycystic ovary syndrome or PCOS. So PCOS has two dysfunctions. So one, there is a component of ovarian dysfunction. So the periods tend to get irregular. There can be a component of infertility. But the reason which causes more hair growth in the setting of PCOS is an excess of male hormone arising from the ovary, and that is responsible not only for excess hair growth. The girl or the lady can sometimes develop acne, even can also have scalp hair loss. What is the physiology of hair? If you are removing your hair through laser, so what it does is it removes the hair from the root. On the other hand, for example, if somebody is getting waxed or threading is the procedure, or somebody is shaving, then it removes hair only from the surface, not from the root. So that way laser is considered as a permanent form of hair removal. But what happens if somebody has excess male hormones? So the excess male hormone, even if the laser is ensuring that the old hair follicles have gone, the excess hormone in the female body will ensure that there is growth of new hair follicles. So even if you undergo laser might not be effective because of an underlying hormone imbalance, and unless you correct that hormonal imbalance by treatment of PCOS or PCOD, whatever you may like it to call, the laser might not be very effective. So in the setting of PCOS, the best treatment for hirsutism is a combination of medical treatment which ensures that the hormonal imbalance or the excess male hormone in the female body gets normalized. And then when somebody is on this form of therapy, you combine laser on top of it. So laser will ensure that you do not have the old hair follicles which are already there, that gets removed, and the medical management of PCOS and normalization of male hormone levels will ensure that you do not have growth of new hair follicles. So these two forms of therapy, medical treatment and laser, they are complementary to each other in PCOS for excess hair removal from the face, and this should be combined. Only one form of therapy might not be effective, but usually the combination treatment will require at least 1 to 1.5 or 2 years. Multiple sittings of laser will be required, and for the same duration the hormone modifying therapy should be given, and that will give you the best results in terms of the hair removal from the face or from any other hormone sensitive area of the body. You can very easily get over all these problems by a combined approach of laser and the appropriate medical management of PCOS. Thank you.